Hey guys, William here from Junior Lion Williams Adventures here in the USA. I had a subject that was on my mind. I wanted to make a video about it and talk about it for just a little while. And what I want to talk about is expats. Should you pay for Medicare Part B if you're an expat, if you're living in the Philippines or in another country? Remember, I said living, not on vacation. Remember that when you turn 65, you're going to have to make a choice about Medicare. They have a deductible for Part B. Part A, I believe, is free. I'm not an expert on Medicare, but I do want to share this subject because a lot of guys that are on a certain budgets, especially the lower end budgets, I believe it's a premium of about $175 or so that comes out of your Social Security check every month for Part B, which I believe is the doctor visits and those kind of things. Part A is for your hospital stay. And then if you have Advantage plans, Part C and these other ones, they're optional. But if you came over to the Philippines and you're living in the Philippines and you were in your 60s, when you turn 65, you'll have to make a decision. And a lot of guys are reaching that age limit. And so that's why some of our subscribers wanted to know, what about Medicare? Especially if you're on lower budgets, $1,200 a month, $1,300, $1,400 or $1,500 a month, $175, and that's going up every year, it seems like, guys. Out of your check is a big chunk. Now remember, if you're an expat, you're living in the Philippines, supposedly, hopefully, you have an emergency fund. Hopefully, you have savings. But those that are living without much of those, and that monthly budget is on the low end, under $2,000, then you're going to have to make a decision what you're going to do about Medicare. Remember that, guys. And the reason that I came up with this subject is I'm back in the US. I'm in the process of selling my house the last couple months, and it's still ongoing to get the best price. But when I had a colonoscopy, it came up that there was a suspicious polyp and they want to do a surgery. And the surgery is going to be at one of the university hospitals here in Philadelphia. And so I kept my Medicare while I was living in the Philippines for the last 2 years. I was paying the deductible because I really didn't make a decision to opt out of it or sign out of it, which you would have to do with a letter to the Social Security office. So guys, if you're 62 and you haven't reached that 65th birthday, it doesn't apply to you yet, but it will, because most of the guys that are living in the Philippines are approaching that fourth quarter, that age 65. I know a couple friends that are. So that's a decision you have to make. Now, if you can afford to keep your Part B, pay that deductible, and your income is enough to not worry about that, then good on you. But a lot of people are on the lower end budgets of 15, maybe 1,200 to 1,800. And that $175 a month chunk that's going to Part B, if they're living in the Philippines, remember, you can't use your Medicare in the Philippines. So if you get sick, it's unavailable. And a lot of people are saying, well, if I have a bad situation like a heart attack, I have a stroke, something like that, I'm going to get on a plane and go back to the USA. Are you? If you have a stroke, if you have a heart attack, are you going to be fit enough to get on a plane and go back to the United States? And are you going to continue paying your Medicare while you're living in the Philippines, let's say? Now remember, I have insurance in the Philippines also, not only for me, but for my wife and my daughter by marriage. So I'm paying that, and I'm also paying the Medicare Part B deductible, which is a big chunk, $175 or so dollars coming out every month. But I kept paying that because I did find a plan that I could afford that covers me in the Philippines for inpatient care, guys. Remember, if you're living in the Philippines and you have an emergency, Medicare is not going to cover you. Some people say, well, I'm going to fly off to Guam or I'm going to fly off to Hawaii. Are you? If you're really sick, if you really have something that puts you in the emergency room, you're not going to be able to get on a plane right away. So this is a question that we need to decide as expats. Am I going to save that $175, and which is going up, and put that into a plan that I can use in the Philippines, or am I going to continue to pay that deductible in the United States and I'm no longer living there, especially if you have no intention on going back. So that's our question, guys. We hope that you will comment. Let us know. Some of you are already making arrangements with these things, and we'd like to hear from you. What do you do? What do you think about this subject? Because I had to have this surgery over here while I was selling my house, for me, it turns out that it was a good idea that I had kept my Medicare Part A and B while I was living in the Philippines. I just budgeted it out of my budget, and I thought about at times dropping it, but I never did. And I also had insurance in the Philippines to cover me an inpatient. So what do you think, guys, on that subject? As an expat, remember, not a tourist, not on vacation. You should be having insurance for travel insurance if you're on vacation. Remember, we have safety wing travel insurance that we have down in our description, guys, that can cover you. That's what I used when I was traveling back and forth in the Philippines. But I have an insurance in the Philippines for inpatient care. Should you keep your Medicare Part A and B? Those of you that are approaching the time frame when you have to make a choice. Some of you that are already dealing with this situation, comment. Let us know, because the subscribers that are trying to make this decision have been asking me, and they want to know, should they as an expat keep their Medicare Part B? That's the one with the deductible. Most times, in most situations, you can correct me if I'm wrong, those of you that know, Part A is free. And when you get to Part C, those are optional, supplemental, and advantage plans. But Part B, if you don't make a decision, Part A and B, they're going to start automatically deducting that from your check at 65 once you get it. So that's what we want to know, guys. That's what we're talking about. And remember, as we say here at Junie Lyon Williams Adventures, enjoy every day, because tomorrow's not promised. And let us know what you think. Should expats keep that Medicare Part A and B? It's a very good question. I don't think it's talked about enough, because a lot of people don't have insurance in the Philippines and they're rolling the dice. At 65 and over, you don't want to be rolling the dice, guys. I never knew that I would have to come back here while I was selling my house to stay a little longer and have a surgery. Fortunately for me, that I have Medicare Part A and B that's still covered, and I'm not under any penalty. I didn't have to wait on a waiting period to opt back in because I kept it. That's not right for everybody. For some people it is. Let us know. And we'll see you next time with something else here at Junie Lyon Williams Adventures. See you later, guys.